Generally speaking, no. If there's not a problem in the first language, we wouldn't expect there's a problem in the second language. That is, for bilingual individuals, communication disorders typically manifest or show up in both languages. That's it. So if a child has developed Spanish on par and in a timely manner, consistent with that of their peers, then we wouldn't expect a problem with English, or we wouldn't expect struggles with English to be attributed to communication disorders. For example, if you have a classroom full of fifth grade children who speak English as their first and primary language, and they're in a classroom where they're learning French as a second language, we would expect lots of different variation in their abilities. Some kids would pick up French very quickly and very easily. Other children may struggle with it, but we wouldn't anticipate that the struggle was due to a communication disorder per se. So, generally speaking, if there's a problem in the first language, there's a problem in the second language. However, if they're struggling in the second language, that does not necessarily mean that there is a problem in the first language. And that's when the process of response to intervention can come into play to help with a little bit of the vetting. Well, historically, parents who recently immigrated here were really told to stop speaking English and stop speaking their home language and speak only English with their children. And this recognized the importance of English, and English for educational attainment, for higher incomes, for engagement in all aspects of American life. So it recognizes the prominence of English. However, it really doesn't, it discounts the importance of the home language. And we know now that parents really should be supported to parent in the language in which they feel most comfortable. We know that children have the capacity to develop 2 languages or more proficiently. We know that developing the first language actually paves the way for greater skill in English instead of taking away from it. So we really should support the home language along with English for children of immigrant parents. So the short answer to that question, that is, should we use more than one language with a child who has a communication disorder, is absolutely. If the child has 2 languages in their daily life and they rely on 2 languages for meaningful interactions with others, then we should absolutely support both languages. We've learned quite a bit over the last few years, and one is that 2 languages or exposure or experience with 2 languages does not cause a communication disorder in any way, shape, or form. Reducing or eliminating one language from the life of that child also will not reduce or cure or even mitigate the communication disorder. We also know that bilingual children can have a variety of communication disorders. Or to put that reverse, we can have children with autism, or children with Down syndrome, children with hearing impairments, children with developmental language impairments who can be bilingual. And they can develop 2 languages on par with monolingual children with similar disabilities. We also know that we should support the languages that are needed by the child and support the language in which their parents speak as well as the community language. So should we provide support in both languages? Absolutely.